Hi everyone! Today we're going to talk about a clinical case involving a Class 3 composite restoration.
Yes, the patient's name is Galo Perez. A 24 years old male, he came to our clinic with a specific complaint. It hurts when I eat sweet things and food gets stuck between my teeth.
We performed a clinical exam and found a caries lesion on the distal surface of the upper left lateral incisor, which is tooth number 22.
The lesion is proximal in contact with the canine tooth 23. We use transillumination to detect the lesion. It shows a dark shadow, which is typical of radial caries.
Importantly, there were no signs of pulp involvement, and the gingival tissue was healthy, which is good sign for a conservative treatment.
We decided to do a class 3 composite resin restoration focusing on aesthetic and tooth preservation.
Our first step was to plan the proper isolation to keep the field dry and clean.
We use rubber dam isolation. This helps to avoid contamination from saliva and improves visibility.
Since we were working on an anterior tooth, we used either a modified 212 clamp or floss ligatures to stabilize the rubber dam and gently retract the gingiva.
This kind of isolation also makes the procedure safer for the patient.
To shape the proximal wall and protect the contact area, we placed a celluloid matrix band.
And we use a wooden wedge to separate the teeth, styloid, and protect the gum. The wedge also helps to adapt the matrix properly and avoid overhangs.
Now, let's go over the verse sequence we used to prepare the cavity.
First, we use a small round burr, number 1, to remove the outer enamel and initial decay. Then, we use a true conical round burr to shape the cavity and form the proximal box. Finally, we use a flame shape finishing burr to create a fine bevel of the enamel margin. This improves the aesthetic integration of the resin. Next, we follow the etch and rinse technique.
We applied 35% phosphoric acid, 15 seconds on enamel, 10 seconds on dentin. Then we rinse for about 20 seconds and gently air dried. Remember, dentin should look moist and shiny, not dry.
We use a 5th generation adhesive system which combines primer and bonding agent in one bottle.
We applied 2 coats with a microbrush, then gently air dried and light cured for 20 seconds. We used the layering technique to build the restoration in thin increments. This helps to avoid polymerization shrinkage.
Each layer was carefully placed and shaped using a brush to adapt in naturally. We cure each layer with light for 20 seconds.
This technique also helps achieve a more natural and aesthetic appearance, especially in anterior teeth.
After the final cure, we start the finishing and polishing phase.
We used abrasive disc in sequence, starting with coarse grit and moving to fine.
To complete the polish, we use a fine polishing paste to give the surface a smooth and glossy finish.
This is how we restore tooth 22 with a class 3 composite restoration.
We use a minimally invasive and aesthetic approach, following each step carefully to ensure a good result.
Thank
Thank
you
you
for
for
watching.
watching!